Well, let's give this another bash, shall we? My name's Anthony Parsons and I'm the owner of PTSD Forum. I've got to remake this video. The original was 20 minutes and because I'm moving everything to YouTube, then 20 minutes just don't fit there anymore. So this one's about physicians and their lovely diagnostic labels they certainly like to plaster PTSD sufferers with. And you know, there's two kinds of physicians, I guess, and they are, you know, you've got your ones who are they're about the sufferer, and they seem to be a dying breed these days, and then you've got the one who is purely about the bottom line. Now, me personally, I kind of like the one who's about the sufferer, or at least one who's a mixture. You know, they do give a crap about the sufferer. Whilst also, you know, they're in business, they've been through college, they've done a lot of work to get where they are, and they deserve to be financially rewarded for what they do. However, they don't deserve, in my opinion, to be financially rewarded at our expense. Now, where this comes in is through diagnostic labels. For a physician, the reason why they seem to want to apply a lot of labels primarily is because without a label, you cannot write a prescription for a medication. So therefore, if they just wrote out PTSD, PTSD primarily is anxiety and depression. Now, even though it is anxiety and depression, but it's classed as an anxiety disorder, physicians then want to go and write out prescriptions for anxiety, another medication for depression, another medication for sleep, another medication for, you know, God knows whatever else they want to do. Though the simple reasons, you know, PTSD is the worst end of the scale when you're talking about trauma. If you've been diagnosed with PTSD, PTSD itself encompasses a lot of other disorders. Now, whilst the correct term for, or the correct anxiety disorder is acute anxiety disorder, PTSD encompasses your anxiety, it encompasses depression, it encompasses, you've got to look at social disorders like your agoraphobia, your mood disorders, substance abuse disorders, you will have sleep disorders in there. Generally, all of these things are still due to the fact of your trauma, and that's where it lay. But the problem is, medication is not the solution to our problems at that type of dosage. What it is it's a solution for the physicians, because they get kickbacks the more prescriptions they send out, the more they prescribe, the more money they get. And that's how it works. Now, again, physicians are certainly, you know, they have earned the right to be well and truly compensated for the sacrifice to get there where they are, and the education and the cost of education. It's not cheap. However, a lot of sufferers are now being, you know, their health and well-being is being sacrificed because of greed, and that's exactly what it is. The problem, a lot of the problem, is a younger generation coming through. They seem to be more focused about money, wealth, power, greed, and so on, where a lot of the older physicians, more experienced, you know, they're a balanced approach typically found. They'll do both. They'll look at a medication stream, and also your best interests of what's affecting you and not affecting you. PTSD can be managed without medication. Now, that's not to say don't medicate if you need it. I would certainly advise any person who has uncontrolled PTSD to be medicated, and when I say uncontrolled, I'm talking about your ability, how far you've come, whether you've even started to heal your trauma, whether you're in therapy. Because you've been in therapy for 10 years doesn't necessarily mean you've actually done anything active to heal trauma. I help people personally who have been in therapy for 10 years and they've done nothing with their trauma. They're on a handful of medications. A lot of those medications have reactive issues. Their bodies have become so immune to the medication that they're on maximum doses. You know, medications have side effects, and there's a whole list of issues along the lines of it. I'm not medicated at all. A lot of people I work with, they tend to find once they've gotten to the point of where I push them to, they don't require medication either. They can self-manage PTSD. So, you know, if you have PTSD or you're a carer of someone with PTSD and you know, PTSD has been given to you or someone you know or love, and you've been given this big stream of labels to go with it, first thing I would do is disregard the labels. I would probably go and find another doctor, to be honest, someone who cares more about the patient and not about the labels and the medication, and you know, find yourself a physician who is going to use a balanced approach, and that is really important to you as the sufferer or even the carer of that sufferer. You know, I hope you look at those sort of things. Just be broader. Don't necessarily believe what a physician is telling you. Certainly seek second, third, fourth opinions, and don't go on recommendations necessarily from each different physician. You know, use your brain, use common sense, and approach things with a balanced viewpoint. So I hope that helps. This is certainly been minimised, you know, from 20 minutes down to 10 or less than. So I've had to rush through a lot of these things, but I'll certainly begin breaking up topics further from this point forward. I hope that at least gives you some insight and helps you one step further with PTSD and PTSD management. See you on the next video.